welcome back to the Dr. Jones Optimization Academy. And I'm very, very pleased to bring back Dr. Linda Hayes. She did our very first podcast. You can scroll back to that at your leisure, where we did an introduction to peptides. So for those who were not privy to that or didn't get a chance to watch or listen to that, Dr. Hayes is from Pure Pharmacy in Indiana. She started Pure Pharmacy as a way to provide the highest quality compounds to patients to help them heal from the inside out, which speaks to us as naturopaths in the world because that's what we do. Dr. Hayes has extensive knowledge in the endocrine, cardiovascular, neurological, gastroenterology system, as well as mitochondrial restoration, Lyme disease, weight loss, and peptide therapy. And that leads us into why we're here today. So this is part 2 of our peptide conversation, and we're going to be focusing on gut health today. So welcome, Dr. Hayes. Happy to have you again.
Yes, thanks for having me. And this is my student, Olivia. So
Olivia's in the background. You know, on the podcast, they won't see that. We got like a little wave stuff. So, but for the YouTube crowd, they will get to see that. So I'm very honored that you came back and made time for us today.
Of course.
And so we talked about like, hey, you know, we did the peptide intro. And I was like, in a lot of times, especially, you know, because I tend to see a lot of people that are more in the athletic performance world. And we always think about peptides for this body composition, performance enhancement, pain repair thing. But as we know, peptides do so much more, right? And then you know, as I've been prescribing more, I've noticed that, wow, like we're getting great results with gut health using some peptides. I was like, this could be a great conversation because I know so many people suffer from gut health issues, whether it's IBS or IBD, or just nausea, you know, reflux is a big one, SIBO, leaky gut, et cetera, and they're being prescribed medications that are managing symptoms, but are not actually fixing the problem. And it's like a life sentence on this medication, you know? And so that's what we're here to stop, you know, as providers and as practitioners. So that being said, we're going to talk about gut health today and what peptides we can use. So let's kick it off here. So what would be your top peptide for gut health?
Hands down, top peptide for gut health it's called BPC, or Body Protective Complex 157. It is found naturally in our gut mucosa. So taken orally, it can really help to repair the gut. We do use it injectable too, but that's more for general healing in a specific body area. But orally, it's an amazing, very awesome gut health peptide.
And without taking us all to pharmacy school, how does that work? Like, what's the mechanism of action, or what's it doing in the gut?
So it actually has a lot of different mechanisms of action. There's no particular one. It's basically just in itself helping to repair the gut, to kind of put it simply.
Okay. So, and then one thing I was reading about it being like cytoprotective or protective of cells, and also helping maintain the mucosal lining of the GI tract. For those that know, mucosa is the lining of our, most of our GI systems, whether it's the mouth, through the esophagus, through the GI tract as well. And that's what gets damaged in a lot of gut issues, you know. And then the inflammation piece as well, because that's kind of like a underrated piece of gut health is inflammation, right? So
So what it does, it leads to down the line some autoimmune type of like conditions that starts in the gut that can flourish out to our bodies, not necessarily causing disease, but causing other issues and inflammatory problems.
So we spoke, you know, in the beginning, we talked very generally about gut health, but what conditions are you seeing providers prescribe BPC 157 and saying, hey, we're getting good results for these conditions?
A lot of prescribers know that, first of all, to heal the body starts in the gut. So we're starting it with other therapies to help start healing the gut. But to go more specifically, you know, what they're treating things like GERD, reflux. It can help with that. And then they can slowly, you know, get off their proton pump inhibitors that cause a ton of other detrimental, you know, effects from taking those, and we have to deal with that. All the nutritional depletions from them, the PPIs, so then we can get their nutrition back up to speed. Things like ulcers, it can help mend over that mucosal lining like you talked about earlier. So it helps any kind of gut condition, IBS, Crohn's disease. It is kind of your general go-to peptide that is going to just help heal the entire mucosal lining in the gut.
And one thing I want to make sure that we point out is because I know a lot of people have heard of BPC 157 as in the repair world. And just, I don't know if we even said this, like oral
Yeah.
versus injection, right? So, you know,
Yeah.
because I've had people say, hey, I've got, you know, my other doc prescribed BBC 157. I got like a half a vial left. And I'm like, no. Like this is a different mechanism of action,
Yeah.
injection versus oral. So just
Yes. Yes, the injection, what we'll do with the injection, and it's great for repair, for tendonitis, that kind of, any kind of soft tissue repair. And so we'll inject that near the site of injury. But to heal the gut, it needs to be taken, and then it helps the gut that way. Okay.
So one of the things that during my research for this podcast is I read up on was the use of BPC 157 as like an NSAID antidote. For those who don't know, people are taking, you know, chronic use of aspirin or ibuprofen. It damages the mucosal lining, can lead to ulceration, but actually using it as a specific NSAID antidote. And it actually was so cool because there was no toxicity reported, no side effects. And it's awesome, right? So this is something I think for those out there that have had issues with damage to their GI tract from aspirin use or NSAID use, or that's a non-steroidal anti-inflammatory drug. BPC 157 is an option for that. And that was super cool because you're like, okay, well, what do you do for that? Something that's very specific and safe to use. So
it's very hard.
Yeah. Have you seen, is that something that you?
No, I haven't seen
rare.
that yet. Actually, it makes total sense. Definitely. And even with like chronic steroid use, we could definitely use that. And in addition to weaning them off their steroids to, you know, go to the functional level. But, and I think maybe that you guys can see how important BPC 157 is just in general of healing the body.
Yeah, definitely. So now we mentioned circling back to taking it orally. Is there any benefit in taking it with or without food? Have you seen any difference in that?
I've heard some controversy about it, but I don't think it matters either way is what I've come to conclusion. I don't know if you've heard differently, but not me.
Yeah, I usually tell people to take it with food because it's kind of easy to remember, oh, I'm about to eat. You know, my breakfast or lunch, so I'll take my medication just because it makes it a little less likely to forget, because like a kind of memory trigger for that.
Yep.
Now, I've seen BPC 157 in the oral form compounded in 250 versus 500 micrograms. Kind of, is that more severity of the condition, size of the person? Like, what have you seen with that?
I will say I typically don't recommend the 250 microgram dose. It's very low. The only time I recommend it is in the offset that this patient has severe autoimmune-like conditions going on in the body, and to the fact that we couldn't even give them much to help support their immune system, and we're starting so basic with the gut. And then I would say 250 micrograms twice a day to help out with gut repair, so that their body you know, these are the sensitive patients who are really sick. But in general, 500 mics 1 to 2 times a day, maybe even up to 3 times a day, depending on your prescriber and your condition, is typically what's good. Even our kiddos take, you know, the 500 mics. So. Okay.
Yeah, I was going to ask about that. Is there any contraindications for prescribing it in kids? And I think you just answered that. And 500 should be really good. Is there any downside to long-term use of BPC 157?
No, it's a natural peptide found in our gut. And so it can only help us. A lot of times we don't have enough BPC around in our body. That's why when we inject towards the site, and people would say, oh, BPC knows where it needs to go to help healing. But unfortunately, our bodies are so inflamed that we need to, you know, tell it, kind of push it where to go. So that's why orally, we're pushing it to the gut. So.
Okay, awesome. So now we're going to kind of change direction a little bit and steer the ship into the next peptide that you've seen good results with for gut health. Okay. And I think we were talking about KPV was the one that we were discussing, right?
KPV, yes. KPV, it's a kind of a newer one out here. It is a tripeptide, and it is being used in clinical trials to treat Crohn's disease. So what we do is we put it in an acid-resistant capsule, and so that it can bypass the small intestines, it can get down there, and it really has helped to stop spasms and actually heal up their lower intestines.
Okay, well, that's really cool.
It is very cool. And I will say we do have a combination capsule of BPC with KPV so that some patients take the combination.
Yeah, I was literally about to lead right into that. Like,
Mhm.
all the good things we said about BPC, can we take them together? And would
Yes.
that make a difference? Is that capsule also acid resistant? I guess that was a question because if it's acid resistant, like you say the BPC.
BPC is not in general. KPV is. And
Okay.
so there is a way you could split them up if you wanted to really hit the upper, gut health with BPC. And then you could take the acid resistant capsule. You can even take it at the same time of day. But right now, people are just for compliancy, I think, doing it just in one capsule.
Yeah, exactly. Usually taking one capsule a day versus twice. At some point, like, okay,
and we're getting very similar results and good effects.
Okay, awesome. Now, dose-wise, is that something that's like a once a day thing, or is it like BPC you can go twice a day, or what?
You can go twice a day on it. I have not heard of 3 times a day, but it's usually 1 to 2 times a day. And same, it's 500 micrograms, same thing as BPC strength wise.
Okay. Have you seen any reports of side effects with the KPV?
No, not with KPV either.
Okay, awesome.
I know I have a patient too. It's really cured up her diarrhea, her chronic diarrhea, where she couldn't even go out and about. So it really can help.
Oh, that's awesome. And just like BPC 157, KPV is also offered subcutaneous as well.
Yes.
But different condition set, right?
Yeah. Actually, the one that was really helped her diarrhea, she couldn't keep anything down. So she was doing the injectable for, to help control her diarrhea. She had to go a little bit higher and a little bit more often, but it really was helping to control her diarrhea. KPV is a very potent anti-inflammatory. So it has those properties. We've been talking about doing local injections with that anti-inflammatory property, just kind of like BPC. So it's also helping a little bit towards neurologically as well as soft tissue.
Okay. Now, this is kind of interesting because we were talking about, the acid resistant and going lower intestinal tract, and we're talking about BPC is more like your Crohn's disease or Crohn's disease. Now, would KPV be more so on the ulcerative colitis side of things?
Yes.
Okay. Okay. Awesome. Checking on that. That is awesome. I wonder if there's anything else about KPV. Oh, mold. That was the other thing. That's why I first heard about KPV was for mold. Can we talk about that for a second?
Yeah. So it has immuno properties and significant anti-inflammatory. So we actually started using it a lot as a nasal spray to help a lot of patients who have mold issues, chronic mold issues, throughout their sinus cavities. And so getting pretty good results with that too. Okay.
Awesome. I want to keep that as a note as well because nasal spray, I can do that. Take care of that. Okay. Next peptide that as we were doing our outline that we want to talk about briefly was LL37. Now, those who aren't familiar with LL37, like it's been mainly used in the immune system world for either stimulating or balancing the immune system, preventing, infections and all of that. But as we were talking, there's some studies out there using LL37 for SIBO, correct?
Yes, for small intestinal bacteria overgrowth. You want to go lower in these patients. 5 units sometimes for these patients is plenty once a day. Max, you want to use it for 6 weeks. But it really has helped patients, get past and overcome their SIBO.
Okay. Now, what's the rationale behind the 6-week limitation?
I think basically it's kind of like the other peptides. You want to cycle it on and off. So you just don't want to be hitting the gut that hard. It is pretty potent. So.
Yeah. Oh, I have a LL37 story. Like oh my gosh. Yeah. I was not feeling well. And again, we were talking like, hey, try LL37. And no, it definitely stimulated my immune system. Like, it revved it up a little too much. I was like, I want to be like, my fever is at 103 right now. And it calmed down. And I tried it for 3 days, and each day it revved me up. I don't want to scare people off on it. And that's what we're talking about on the immune world, not to get off topic here, is that I think it's got great potential in the prevention, keep the immune system primed and ready. But I think if you are actively sick, to avoid it.
People got to be careful with LL37. Some people just take it lightly, but it is a very potent immune modulator as well as antimicrobial activity as well.
Okay. And then there were some other things about it's, you know, because I was all into this because I was like, oh man, you know, I dove into it. And the LO37, I saw there's some research out there about it actually inhibiting gastric cancer cell proliferation.
Mm-hmm.
But it was like, you know, on the same token, other side of that coin is that overexpression of LO37 can actually promote progression of ovarian, lung, and breast cancer. So it's like you have to be careful, you know, getting a good history on these patients to make sure that they're not at risk for those things if we're going to go there with it as well.
For sure.
Have you noticed any reports in the SIBO world? I don't know if you've seen it. Any issues with nausea or GI pain when they're using SIBO? I'm sorry, LO37 for SIBO?
I have not. I've not had that reported in like what I've dispensed.
Okay, gotcha. Okay, next on our list is, this one is not as well known as a peptide, is a product called lorazepam.
Mm-hmm.
And so if you can, talk me through lorazepam a little bit and what it's used for and, you know, what potential it has. So I know it's kind of new.
Yeah, this is very new. We've had it for a little bit, but it's so new, and I haven't had a chance to explain this to a lot of prescribers about it. It is so lorazepam is in clinical trials for celiac disease. And so even if you go to the Celiac Foundation page, they will mention lorazepam as one of being the first drugs that could potentially, you know, help celiac disease patients as a peptide drug.
Okay.
And it is an oral capsule too, which is nice.
Okay. And you guys are compounding that, right?
Yes, we are.
Okay. Now, for those that don't know, celiac, most people do at this point in history, right? So celiac is gluten intolerant, so considered an autoimmune condition where your body can't process gluten. You know, so, and with that being said, it really does a number on the GI tract with diarrhea and nausea and stomach discomfort. It can affect, you can get skin conditions with it as well. Just arthritic, it's a painful thing, right? Is to have celiac with as well. And so the thing about it, and I was reading up on the lorazepam, is that it was about the tight junctions, right? So the issue is you eat gluten, and actually the damage, you know, the autoimmune reaction happens when it leaves the GI tract and gets into the bloodstream, right? So if you can have something that's going to, you know, kind of keep those junctions closed and prevent the celiac in the bloodstream, you prevent some of that inflammatory process that gluten triggers, right? Kind of like a shoelace thing we're reading as well. Now, is it still in phase 3 trials, or is that?
I think it's still in phase 3 trials still.
Okay.
I think a lot of things have slowed down lately, so. Okay.
Gotcha. Yeah, I was reading up on it. I was like, oh, it's really cool. And this is especially for those people who, you know, because the thing about it is that, and I was like, okay, you still want them to avoid gluten.
Right.
You know, it's like, oh, here's this thing. Now go have all the gluten you want, right? Because that's not what it's for. It's just for those who do have more severe side effects when they ingest gluten. So now, do you think it would have any benefit on those that aren't celiac but more gluten intolerant? Because it's kind of the same concept.
Oh, yeah, right. Same concept. You know, basically a lot of leaky gut is because of, you know, the weakening of the tight junctions. So if we can keep those intact, even patients who don't have a gluten intolerance, I think that it can definitely help them.
Okay. Gotcha. Okay. Let's see here. And with all the GI peptides, just to make sure, have you noticed a lot of times people are taking other medications, and this is more so on the BPC 157. Anything you'd be concerned about with interactions that you've seen?
No, it doesn't interact. It's not going to stop your medications, and I've not heard of anyone having side effects. It's very, very easy, natural peptide for our bodies.
Okay. Awesome. This is amazing. So let's summarize. Number one, our BPC 157. For those that are having more issues in the lower intestinal tract, you want to consider the KPV. LO37, more so in the SIBO world. So there's options out here for us that, you know, safer options is a better way to say it. So anything else you want to circle back or talk about on this?
No, I think we hit pretty much it nail on the head. BPC is kind of superior in our world for gut health. in addition to, of course, some other things that we did outside the peptide world. But, you know, KPV is on the rise. We're doing more and more of it. You know, you're right on LL. It's got its own place. I think we could really see a lot more of lorazepam prescribed. I haven't put as much information out there. I think, you know, sometimes it takes a little push to really get that right patient population and have them start, you know, recovering. And then it takes off from there.
Awesome. Awesome. Well, thank you again for spending some time with us today to talk about peptides for gut health. For those listening and watching, where can they find you?
So Pure Pharmacy, we're located outside of Indianapolis, Indiana, in Carmel. And our phone number, in case you have any questions, 317-740-1856.
Okay. Do you guys have Instagram or Facebook?
Yes, we have both. We're Pure Pharmacy out of Carmel in both Instagram and Facebook.
Okay, so just at Pure Pharmacy.
Yeah, I think.
Okay, yeah, it won't be hard.
Take care of it.
It's like you're like, something out there.
I know. So.
Yeah, and your website is.
So our website is www.purexcompounding.com.
Okay. And for the prescribers, the docs and practitioners that are listening, they can call the number or go to the website to open an account with you guys?
Exactly.
Okay, perfect, perfect. Okay. Well, thank you again. I am super excited for this as well. And, you know, in a little while, we'll bring you back because I clearly love talking about peptides and, you know, and love dealing with you guys and work with you guys. So I appreciate it. And that is it for today, you know, and if you guys have any questions, comments, or concerns, just, you know, there's always a way to reach out to us, whether it be the YouTube comments or, you know, sending us an email, or I guess it would be me an email at this point, right? So email wise would be info@drgregjones.com, all spelled out. My Instagram is at @drjones_Dr. Jones, all spelled out, because all the regular Dr. Jones were taken. So I had to take what I had. So all right, guys, that is it for now, and we'll be talking to you soon.